name is Holly Davis, and I'm a nursing student. I'm here to do your comprehensive health exam today. Can you tell me what your name is?
Stacy Fisher.
How old are you?
22.
And what is today's date?
The July 29th.
Okay, and where are you?
Holly's house.
Okay, great. So the patient is alert and oriented to time, place, and person. Her facial expressions appear normal or appropriate for the behavior or situation. Patient appears stated age. She is well nourished, appropriate height and weight for age and gender. And so we're going to go ahead and get started. So first I'm going to assess the skin. So her skin is warm to the touch. Skin color is pinkish tan, and the color is even and smooth, and there are no lesions present. We're going to first start by the head. We're going to palpate the head. So I'm palpating, and her head is round, symmetric. No masses are felt. Hair is soft and thick and evenly distributed. Now I'm going to test the temporomandibular joint, and if you can just open and close your mouth. Okay, and her TMJ joint opens and closes smoothly, and there are no cracks or crepitus. Now I'm going to test for cranial nerve 7, so if you can wrinkle your forehead, raise your eyebrows, squeeze your eyes closed. Smile, frown, and now have you puff your cheeks out and resist me pushing. Okay, so that is testing for cranial nerve 7, and that is intact. We're now going to test cranial nerve 5, so if I can have you clench your teeth. And then I'm going to also do test sensation, so tell me when you close your eyes and tell me when you feel the sensation.
Now.
Okay. So cranial nerve 5 is intact. We are going to move on to the nose. I'm going to inspect the nose. I'm inspecting for symmetry. Each nair is symmetrical bilaterally. Now I'm going to look in her nose. So the mucosa is pink. There's no discharge, no swelling or lesions. The turbinates are also pink, and no lesions or perforations on those. No signs of deviated septum. So now we're going to move on to eyes. Oh, look at that, I dropped my pen light. We're going to test for patency in the nose. Okay, so each nair is patent. Now we're going to move on to eyes. So I'm going to inspect her external eye structures. So her eyelashes are evenly distributed on the lid margin. I can have you close your eyes. Her eyelids are appropriate and approximate when they're closed. There's no lesion, swelling, or redness. I'm going to have you open your eyes again. We're going to inspect the sclera. It is white, no discoloration. We're going to check the conjunctiva, and they are clear and moist, and there are some blood vessels present. Now we're going to check the iris. The iris is blue in color, even in color, has defined margins, and is flat and round. Next, we are going to check the pupils. I'm going to go ahead and check the pupils. So I'm going to run my light across your eyes if you want to focus on the dot on the wall behind me. Okay, so her pupils are reactive to the light. Pupils are round, equal, and now we're going to test for accommodation. So focus on the dot on the wall, and now look at my pen light. Okay, so accommodation is present. Now we're going to test her extraocular muscles. So that is cranial nerve 3, 4, and 6. So I'm going to have you just look with your eyes and follow my finger, okay? Okay, so her eyes are moving parallel, and they move inwards, medially, laterally, and up and down. Now we're going to look inside the eye at the internal eye structures. So I'm going to use my ophthalmoscope. We're looking inside the eye. Her ocular fundus is red in color. The vessels are present. There's an artery and vein paired in each quadrant. The optic disc is yellow in color, round with defined margins. The macula is 1 disc diameter and size and is a little bit darker than the fundus. And the fundus is red in color. And now I'm going to check her other eye for the same thing, and each eye is equal bilaterally. Now I'm going to check her ears. So we're assessing her ears for alignment. So her ears are aligned and they're equal bilaterally. Now we're going to test for tenderness. So Stacey, let me know if you feel any tenderness when I palpate. Any tenderness?
Nope.
Okay. So now we're going to inspect her internal ear structure. So I'm going to look in her ear, and we're looking at the tympanic membrane, which is a pearly gray color, and it is intact. And the cone of light is at 7 o'clock in her left ear, and in her right ear, her tympanic membrane is also pearly gray and intact, and cone of light is at 5 o'clock. Now we're going to test her hearing. So we're going to do the whisper test. Okay, so just recall back what I whisper in your ear. We're going to do it on both sides. So, cat. 8.
I'm sorry, that was loud. C.
I'm sorry, it's really loud. Tree.
S.
Okay. Patient was able to recall correctly the numbers, words, and letters that were whispered in her ear. So she passed the whisper test. Now we're going to move on to the mouth. So we're going to inspect her lips. And her lips are pink and moist. Her buccal mucosa is pink and moist. And her gums are also pink and moist as well. Her teeth are all present. There's no missing or broken teeth. Now we're going to check for, cranial nerve 10. So I'm going to have her say ah. And her uvula and palate rise on the midline. And now we're going to test for cranial nerve 9 and 10. This is where I would check her gag reflex, but I'm not really going to check it. Now we're going to check for cranial nerve 12. So if I can have you stick your tongue out, your tongue protrudes in the midline as well. Okay, so now we're going to go on to the neck. I'm going to test your range of motion in your neck and the strength. So if I can have you put your ear to your shoulder. Okay, and now we're going to test for strength. Okay, and then head forward and head all the way back. Okay, and then forward again, and then back again. And I'm going to have you turn side to side. Okay, and one more time. Okay, so she has full range of motion in her neck and strength of 5. And we're also going to do a shoulder shrug. So we're going to have you shrug your shoulders. Okay, and now we're going to do it once with resistance. Okay, and that is checking cranial nerve 11. Now we are going to move on to checking her trachea. So we can inspect and palpate that her trachea is midline. And now we're going to do thyroid. So I'm going to give her a sip of water. And as she sips the water, we're going to palpate her thyroid, and it's going to move upwards. And there's no enlargement of the thyroid, and it moves up symmetrically. Now we're going to palpate for lymph nodes. We're going to do the preauricle. Let me know if you have any tenderness, okay? We're going to do preauricle, postauricle, occipital, and then tonsillar, submandibular, submental. Then we're going to do the anterior cervical chain and then the posterior cervical chain. Okay. So no nodes were palpable. Stacey, did you feel any tenderness? No. Okay, great. Now we're going to move on to her anterior thorax, heart, and lungs. So I'm going to inspect her skin. Her skin is warm. I don't feel any palpitations, thrills, or heaves. And her skin color is smooth and even. Color is pinkish tan. And she does not use any accessory muscles to breathe. And her thorax is symmetric. Her AP diameter is less than her transverse diameter as well. Now we are going to palpate. So I'm going to palpate her supraclavicular lymph nodes and her axillary lymph nodes. Did you feel any tenderness?
No.
Okay, and no lymph nodes are palpable. Now we are going to, I palpated the precordium. There were no thrills, heaves, or pulses. Excuse me. Now we are going to check the carotid pulse in each side. Okay, and then her carotid pulse is 2+ and equal bilaterally. I'm going to have her lay down. And we are going to palpate her apical pulse, which is going to be in her 4th or 5th intercostal space, and hers is in her 4th intercostal space at the mid-clavicular line. And it feels like a gentle tap. And now we're going to compare the apical pulse with her carotid pulse, and they match. And when I palpate her precordium, there are no S3 or S4 heart sound or heart palpitations felt. Now I'm going to auscultate her lung sound, so you can sit up. Okay. So if I can have you turn a little bit towards the camera, we're going to palpate, we're going to auscultate over all her lung fields, and we're listening for any diminished breath sounds, clear breath sounds, and any adventitious sounds. So we're going to check on the side over here, and all breath sounds were clear, and no adventitious breath sounds were heard. Take that off. Now we're going to auscultate her heart sounds. So we are going to start with her aortic area, her pulmonic area, Erb's point, tricuspid area, and mitral area. Okay, and S3 and S4 sounds were not heard. We did not hear any dysrhythmias or murmurs. And we're going to listen to her apical pulse. Her apical pulse has regular rate and rhythm. And what am I forgetting? Bruise. And there are no bruits present. Okay. Also, the S1 sound is heard loudest at the apex, which is at the bottom of the heart. And then the S2 sound is loudest at the base of the heart, which is at the top. Okay. Now we're moving on to posterior thorax. So we're going to assess her skin and configuration. So her skin is pink and tan as well. It's smooth and even. Her ribs are sloping downwards. Her scapula are symmetric bilaterally. And now we're going to test for, oh, she's not using any accessory muscles for breathing. We're going to test for respiratory expansion. So I'm going to put my hands here, and as she breathes in, my thumbs move apart, and when she exhales, my thumbs come together. Okay. Now we're going to listen to the lung sounds on the back. So we're going to listen in all areas, listening for diminished breath sounds or any adventitious sounds. And all breath sounds are present, and there are no adventitious breath sounds. Okay. So now we're going to assess the abdomen. So I have Stacey laid down. We're going to inspect the color of her abdomen and skin texture. So her abdomen is pinkish tan. And also for this video, we're not going to have her lift her shirt up. So in a real exam, we would be examining skin to skin, listening to breath sounds and heart sounds on the skin and not through the shirt. So her abdomen is pinkish tan, even color, consistent. There's no lesions, striae, or scarring, and no pulsations are present. So we are going to start by listening to each quadrant of her stomach for vowel sounds. So there are normal active vowel sounds in each quadrant. We're also going to listen for the abdominal aorta and see if there's any bruits, and no bruits are present. We're also going to listen for renal arteries, iliac arteries, and femoral arteries. And no bruits are present there either. And now we're going to start with palpations. We're going to start with light palpation in each quadrant. Tell me if you feel any tenderness. And no masses are felt. Did you have any tenderness?
No.
Okay. Now we're going to start with deep palpation. I'm going to push a little bit harder. We're able to percuss the liver, palpate the liver, sorry. Come over to the other quadrant. No masses there. The spleen is not palpable. And there are no masses in the other two quadrants. Now we're going to try to palpate the kidneys. And the kidneys are not palpable. Now we're going to start with percussion. So we should be hearing tympany over each of the quadrants. And we do hear tympany. And then we're going to test for liver, the liver span. So we're going to start up here, and we should hear dullness. And when we stop to hear dullness, then we'll start down here. And then we'll measure, and that is about 7 centimeters for our liver expansion. Okay. Liver span, not expansion. Okay. You can sit up now. Okay, so now we're going to check for jugular distension, and her jugular veins are not distended. We are going to check her capillary refill in her fingers. And we're also going to test for clubbing. There's no clubbing in her fingernails. We're also going to check capillary refill in her toes. And capillary refill for her fingers and toes is less than 3 seconds. Now we're going to start with the pulses. So we already did her carotid pulse. Now we're going to start with a brachial pulse. And that's 2+ and equal bilaterally on each side. Carotid or radial pulse is 2 plus and equal bilaterally on each side. Then have you lay down, do your femoral pulse, and that is 2 plus and equal bilaterally on each side. You're going to do her popliteal pulse, 2 plus equal bilaterally on each side. Her dorsalis pedis pulse, and the posterior tibial, and that's 2 plus and equal bilaterally on each side. My brain just blinked. Okay, and we've already auscultated for Breeze in the main arteries, and there were none. Now we are going to move on to neurofunction. So what we're going to do is test your cerebellar function, and for that we are going to have you put your finger to nose, we'll have you close your eyes and do finger to nose. Okay, and she is doing that accurately. And now we're going to do heel to shin test. So you're going to take your right heel and run it up your left shin, and the same on the other side. Okay, she does that accurately as well. Cerebellar function is intact. Now we're going to test her sensory function. So I'm going to have you tell me if it's soft, dull, or sharp. Okay, so have you close your eyes. Let me know what sensation you feel.
Soft. 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 Soft.
Okay, so she felt the sensations in each of her extremities, and they were equal bilaterally. Now we are going to test her. We're going to do the deep tendon reflexes. So we're going to do it in her brachial, or her triceps, I'm sorry. And we're going to do it on this side. And those are 2 plus and equal bilaterally. Brachial. Okay, those are 2 plus and equal bilaterally as well. We're going to do the brachial radialis. 2 plus equal bilaterally. And then we're going to do patellar. And that is 2 plus equal bilaterally. And then we're going to do the Achilles. 2 plus equal bilaterally. And now we're going to move on to the Romberg test. We're going to have you stand up and close your eyes and stand as still as you can. Okay, so she's standing still, maintaining balance for 20 seconds. That's great. So she was negative for her Romberg's test. Now we're going to have her do her heel to toe walk. So she's going to walk with her heel to toe, and she is doing that accurately, and her gait is still balanced. Now if she can walk normally, we'll assess her gait. She has a normal, well-balanced, and coordinated gait. Okay. Sorry, what?
I keep on sitting when you don't tell me to.
Oh, now we're going to check her spine. So if she'll bend over, we can see that her spine's processes down the middle, and she's touching her toe, so that's testing her range of motion in her toe, or her back, and if her scapula are equal bilaterally. Now can you lean backwards for me? Okay, and then side to side, and then twist at your waist. Okay, great, so her spine has full range of motion. Now we're going to test her range of motion in her upper and lower extremities, so you can sit down. Well, actually, never mind, you can stand up. And then raise your arms up to your head, bring them back down, and then bring them forward and up and back. Great. Now we're going to do the one where you put your arms up with your back and reach up towards your shoulder blades. Okay, great. Now you can have a seat. We will test your arms. So bring them up and then down. And we're going to test for strength. Bring them up, push them down. I didn't test for strength up here, so if you want to raise your arms and then push them down. Okay, great. And then we'll do wrists. So lift your wrist up and down. I'm going to test for strength. Okay, and then we will do out and like that. Great. And then we'll do fingers out as far as you can, and then make a tight fist. Great. Let's see. And we're going to have you do the thumb to each finger. Okay, awesome. Now let's do range of motion in your hips. Okay, so what we'll have you do is you'll raise one leg up as far as you can. Okay, and then raise that one up. Sorry, no, that's okay. I guess we should be, okay, and resistance. All right, and your other leg. Okay, and raise up as far as you can. Okay, great. Now we're going to have you bring your knee up and push it in as far as you can. Okay, and then you can put it back down and touch your other leg. Okay, and now we're going to have you tilt your leg out and then cross it back over. And let's test for strength there. Okay, and then your other leg. Oh, sorry. Okay, and then test for strength. Okay, and then now we're going to have you lift your leg back up in that 90-degree angle and rotate your leg outwards and rotate your leg inwards. Okay, and we'll do that with strength, resistance. Okay, other leg. Sorry, I keep wanting to do strength first. Okay, strength. All right. So now you can sit up, and for your knees, we'll have you extend your leg all the way up and back down. Okay, and then we'll test for strength. Okay, and then for your toes, we're going to have you point your toes all the way down to the ground, and then point your toes up towards your nose. Awesome. We'll test for strength there. Okay, and now we'll have you scrunch your toes and then separate them. Okay, great. And that should be all for today. Do you feel great? Feel awesome?
Yes.
Great. So you passed your physical exam. We'll see you in a year.
Yay!